So we looked at the data from, it was a very large study called the STERIO study that looked at the impact of riociguat in patients and if it made a difference in terms of their pulmonary pressures, blood pressure, and we measured outcomes like 6-minute walk tests and things. So that was published in the Lancet, and it was a very large group of multidisciplinary researchers that worked on that study. So based on some of that data and what we saw in the baseline data, we wanted to ask the question, some of the screening criteria were if people had nephropathy or if people had high blood pressure. So those were considered high risk criteria because there's been some prior associations with those patients having pulmonary hypertension. So we wanted to see if that made a difference in their baseline 6-minute walk test. And we did see a difference. So if, for example, you had one high risk criteria, your pulmonary hypertension or your 6-minute walk test was a certain amount. And then if you had 2 risks, it got lower. And if you had 3 risks, it was much lower. And so we did see an association with these high risk criteria and baseline 6-minute walk tests. And we went on to look at a few other things, including their oxygenation and things. And again, those high risk criteria correlated with those as well at baseline. And so we were wondering, and even their proteinuria got worse as their high risk criteria and those 6-minute walk tests got worse. So the question becomes, could you potentially use some of these? It's a very low resource evaluation, right? It doesn't require blood. It doesn't require anything. It just requires the patient to walk and a pulse oximeter. So could you use something that is very low resource intensity to be predictive of some of these other issues developing? And then if you had enough data, maybe even as a screening criteria.